Hi, I'm Dr. Iresh Shetty. I am a consultant cardiothoracic and vascular surgeon at KMC Hospital, Mangalore. In patients with significant coronary artery disease, of course, the patients come with symptoms of chest pain or easy fatigability or tiredness and come to our hospital. We decide the treatment based on the percentage of blockage in these coronary arteries. So, once a coronary angiogram is done, the severity of stenosis can be assessed. So, we calculate by percentage. If in case a person has less than 70% of blockage, these patients can be given medications. If in case the patient has more than 70% blockage, we have to decide between two types of intervention. One is coronary angioplasty or a stenting, and the second is coronary artery bypass grafting or open heart surgery. So if in case the patient has less than 70%, we give medications and see how the patient is tolerating it. If these patients, even post taking medications, are still symptomatic and they're not having any relief of pain, then we may have to still go ahead for an intervention procedure, that is a stenting or a surgery, even though the blockage is not more than 70%. Stenting is usually done to patients who have blockages more than 70%, but involving usually one or maybe two vessels. And if in case the patient comes with an acute MI or an acute heart attack to our hospital, that is the emergency procedure that can be done to stabilize such patients. Other patients that require stenting are patients, as I said, who are not settling down with medications, patients who cannot undergo open heart surgery or cardiac surgery due to various reasons, such as severe comorbidities, or in patients who have undergone previous stentings and just require an opening up of the previous stent. Coronary artery bypass grafting again is another interventional option that has to be done for patients having coronary artery disease more than 70%. But the indications for coronary artery surgery include, as I told you, significant blockage more than 70%, but involving two vessels or more, and in the two vessels, one of the vessels has to be the major vessel of the heart that runs right in front of the heart. Along with this, it can be done if it involves the left main artery, which is the artery before the left side divides into two, and if that blockage is more than 50%, again these patients have to undergo open heart surgery. The other indications for open heart surgery include a failed previous stenting, a patient having persistent pain or symptoms following medications, a person who has very low ejection fraction, which is the pumping capacity of the heart, a patient who is having complications of heart attack, which includes something called as a ventricular septal rupture or a cardiogenic shock, and a patient who has multiple vessel disease and is a diabetic. So when a patient is on medications for coronary artery disease, he has to be on regular follow-up. It is of course the most easiest of all the treatments, and a patient tolerates it better because it does not involve any intervention. But if the patient is still persisting to have symptoms, that means the medications are not working, in which case the patient has to go for an intervention procedure. So the risks of course are there, because the patient can still have a heart attack because we have not sorted out the block. We are instead just controlling the disease with the medications. To be clear, the medications do not stop, the disease continues to progress. We are just stalling the disease and it will progress. The only problem is we cannot predict the speed of progression. Sometimes these patients may not have any issues for the next 10 years, 15 or 20 years following medications, but some patients may have issues even after 2 months of starting medications. If a patient does have problems following medications itself, we have to then take a call to go for an intervention procedure, in which he can either go for stenting or for surgery. Stenting of course is a smaller procedure, less invasive than an open heart surgery, and it is done quicker and the recovery is always faster. A patient who has undergone a stenting can probably recover and can be discharged from hospital the same day or the next day, depending upon how severe the stenosis was and how the procedure was tolerated, and can probably return to work within a week or 10 days. Of course, he will be on certain medications for the rest of his life to maintain the stent, and he has to be there for regular follow-ups to our hospitals whenever he is called for the same. During these follow-ups, he is checked for blockage again, which is a high possibility for certain patients. The certain patients that can have a reblockage or a restenosis of the previously placed coronary stent include diabetic patients, patients who are not taking medications regularly and who are not following advice that has been given by their doctors. Patient who has now undergone either a stenting before or is on medications with no relief of symptoms or has a significant blockage or a multivessel blockage and has to undergo surgery will undergo a coronary artery bypass grafting or a surgery. The risks, of course, are always there with cardiac surgery, as when we do cardiac surgery, we have to assess the body in toto, starting from head to toe. All the organs in the body have to be assessed and optimized, and if the patient has any underlying disease from before, these can increase the risks that are involved or the complications that are involved during or even after surgery. So the risk percentage is usually around 5%, which means there is a 95% success rate, so which is a high percentage and is usually better preferred. If in case the patient undergoes an open heart surgery or cardiac surgery, the chances of restenosis are lesser as compared to stenting or medications, and the patient will probably have a better relief of the symptoms that he had for cardiac issues. Of course, these patients will require a longer time to recover, and they will take a longer time to return back to their normal routine or daily work as compared to a patient undergoing an angioplasty. The patients who undergo cardiac surgery, depending upon the technique of cardiac surgery, if they have undergone conventional open heart surgery, then they will require up to 3 months to return to regular work, up to 1 month to return to desk work, and up to 3 months to return to driving or any other physical activity. A patient who has undergone a minimally invasive or a robotic assisted cardiac surgery can return to work much earlier, possibly after 2 weeks to a month after surgery, that is to regular work, and to desk work after 2 weeks, and regular physical activity probably after a month. Again, depending upon how the procedure has been tolerated by the patient in the post-operative period and how well he has done his own rehabilitation in the ward and at home, and if he has followed the advice accordingly. All these patients' risks and benefits and all the outcomes depend solely on the patient also, because it depends upon whether the patient is on regular follow-up, whether he follows the advice, whether he takes his medications regularly, whether he exercises regularly. All these determine factors as to the success of the procedure that was performed, whether it be stenting or surgery, and of course medications, and whether it is advice is followed accordingly.